in order to do health equity work, in order to do anti-racism and anti-oppression work, we have to be comfortable with being uncomfortable. We just have to be. We have to know, because it's impossible to be culturally competent. We're never going to be experts in every possible culture that there is, because culture is, it's broad and vast, but it's also incredibly individual. It can be incredibly individual to this parent versus this parent within the same family, right? To this family system, to this community, to this, and so on and so forth. So we have to push through that discomfort, and we have to be willing to, again, just understand the discomfort is a part of this. Our division head, Jennifer Kett, will often talk about like building our equity muscle, right? And that's really is what it is. And in order, think about, I always use this analogy, and sometimes people laugh at me about it, but like if I'm going to go take a French cooking class, right? When I walk in the door and I know nothing about French cooking other than the fact that I want to take a French cooking class, the cooking instructor, isn't expecting me to be an expert at this, right? I have to practice. And I always use French cooking because to me, it seems like it's some of the most complicated cooking that there is out there, right? But I have to practice and hone my skills and get it, because it's never gonna be perfect. It's never going to be perfect. And I think the same is true in health equity work and in anti-racism, anti-oppression work. We're never going to be perfect. We're going to make mistakes. We just need to find a way of being comfortable with being uncomfortable. And that's hard. And that's hard in systems in which we're expected to be experts, right? Where if we're not an expert, it could be a matter of life or death. But if we can kind of take a step back and recognize that in this work, we're never going to be experts.